Hey, Dr. Lindsey and Wendy here. This is another one of our more serious videos. We had a guy come in that moved here from someplace else, and he'd had 2 pretty good hair transplants done out of state. And frankly, he doesn't need anything done now. But like a lot of guys, he's got some hair greed, and so he could convince me that he could have a small case.
He needs more density right around here.
So he came in and we talked just about these issues, and I suspect that at some point he'll do a case. But then he said I was the first person he talked to in our area, and I said, just do your research. We
always encourage for you to go and see the difference between
us and
other people. Yeah.
And so about 18 hours later, he emails me a link to a video from a clinic that's pretty close to us, that is relatively new in our area, that is got some kind of I don't know whether it's patented or trademarked, or maybe they just call it we'll call it the Joe's lift or the Joe's graft, and it's neither
like
Joe
the Lindsey's grafts.
Yeah, and the guy, this guy's been through 2 cases before, and he kind of knows what to look for. He goes, "You're not going to believe this. They don't even have microscopes at their office. They're doing 1995 style micrografts, where they cut out a strip with that." I don't know how they're cutting out the strip, but then they don't sliver it. They just cut it into little cubes, and then they have 1 or 2 cutters that cuts it into micrografts. And they're calling that state of the art. And so, and I'm sure it happens everywhere. Not just happening 5 miles from my office. It's happening 5 miles from every doctor's office, probably. So if you see stuff like this, you can figure this out pretty easily. You go and want to see a case and see how they're doing. Look for microscopes, see who's doing what job, whether there's a doctor that's involved. Ask to see pictures or videos of people they've worked on. That's going to eliminate most of the...
He did say that he looked at some pictures, but it was from a different state office that they had. And he's like, I didn't get to see nothing from that.
Yeah. And so if you just do that, you can protect yourself 90% of the time, and then just shop around. Certainly price does play a role, but if you're paying half price for a 25-year-old technique, that might not be the best way to do it.
Yeah.
So proceed with caution. Forums on hair transplants and Dr. or Mr. Spencer Coburn's radio show. They're great places to get educated, and certainly YouTube, and nothing beats a visit to an office and seeing a case going on. So if we can help you, give us a call. Thanks.